OET speaking role play. First, we will give our intro. Hi, I'm Priyanka, one of the registered nurses in this unit. May I know your name and age for verification purpose? If patient is inpatient, then we will ask him about verification purpose. If it's new patient, then it's for documentation purpose. There are two scenario of community nurse. If it's a home visit or if it's a community clinic. If it's a home visit, then you will give your intro. I'm Priyanka, community nurses from the local community center will be visited the patient at home. And scenario, if patient came for review, checkup or scheduled appointment. Third scenario is walk-in patient and fourth scenario inpatient. If it's your patient, it means you will not tell your name. You just tell him, "Hi, good morning, John. I have some news for you." Or either you can say, "John, good morning. How are you feeling today?" If patient says feeling pretty restless about that, then you will say, "Don't worry. This is all very temporary and you will be fine in no time." If patient admitted before but you are meeting first time, then your intro should be, "I will be taking care of you today. Well, I understand from your case notes." Or either you can say, "I went through your case note and got that you now that you understand bunion surgery. Is this correct?" All right, before proceeding further, could you please verify your name and age for me? Again, if it's home visit, then you will give your intro like, "Good morning, Julia. I'm back for another visit." If it's your second or third visit, "Is it good time to talk to you?" Either you can say, "I'm back to check your progress. How are you feeling today?" Permission is important. You will assess from two level. One is linguistic communication criteria and either another is clinical communication criteria. Your speech should be clear and voice modulation. Accent is not important. Pronunciation, vocabulary and grammar is more important, and also your tone. And never be judgmental. Means you should not assume anything about the patient. If condition is ESRD and stage of renal failure, then you will say, "Well, I completely understand how you might be feeling right now, but please trust me, you will be fine in no time." It's assurance and reassurance. You are at the right place. We are doing everything good treatment or therapies for you. We have a wonderful team of health professionals. Next is advice. I'd advise you to go ahead. Please go ahead. I'm glad that you are agree to this. It it may be any therapy or any treatment. Another thing, in case it's a sensitive topic, then you have to be tactful. You have to be very careful not to hurt them. Then you will say, "Please understand whatever you share with me it will remain confidential. If patient here it's confidential, then it make a bond of trust and they can share everything with you. If interlocutor only say yes or no, so you have to say, you will say, is that so? Let me explain it to you. Okay. Next thing is suggestion. Suggestion means if it's remedial measures to overcome this problem, or maybe suggest a few stress management technique, then you can say, may I suggest few exercise which will help you to strengthen your bone? Shall I tell you about it? The patient says yes, then you can continue. And advise, I strongly advise you to go ahead with the therapy or treatment. Also, you can trust me. For example, if it's chemo, then you have to say like this, strongly advise, it's beneficial for you. If patient with chemotherapy, you are at right place. We all are there for help you out. Let me reassure you that this is a very simple and common procedure, and this usually happen in kids all the time, so you don't have to worry at all. If stress the importance, then you will say exercise, importance of the exercise. Well, you do want to have speedy recovery, don't you? Then patient says yes. Well, physiotherapy will customize a simple exercise plan for you for your needs. This will help in your speedy recovery. Or you can say, may I schedule an appointment with physiotherapist, dietitian or counselor, anyone. If it's a dietitian, then dietitian. Shall I should you is an appointment with our dietitian? They will be able to help you out with the proper meal plan. Would that be fine? Or either you can say, how does that sounds? It means you have to ask question. And the last keyword is inquire. Inquire means you will ask when, since, when you have been experiencing this pain. If you don't mind, may I ask few questions about your lifestyle? If patient says yes, then what do you do for living?